Granicus website through the county website, but I will reload them in the chat feature for everyone.
And if you can email it to everybody too.
Yes, sir. Commissioners, you should have received the agenda around 4 o'clock in your emails.
Right. I think I got one also at 11:53. Today. Okay, are we ready to get started, Robin?
Yes, Mr. Chairman, we're still waiting on 2 of our guest attendees, but we have all commissioners ready to go, and 3 of our presenters. Thank you.
Okay, we're waiting on the 2 other presenters.
Yes, I don't see our representatives from Novant or Wake yet.
Do we have any way of reaching out to them?
Yeah, I'm going to send an email. I've got staff sending emails now.
Why don't we go ahead and get started because I know they are going to be making a presentation also after a few other presentations. So let's go ahead and get started. The purpose of this meeting is to receive COVID-19 updates on the state of our county and for us to take any necessary action according to this pandemic. And we're going to ask our health director, Dr. Eula Van, to kind of lead us through this presentation and introduce our panelists and people who will be making our presentations. Dr. Van?
Thank you, Chairman, and good evening, members of the board. Thank you so much for allowing me the opportunity to lead us through this conversation. I'm going to go ahead and share my screen. We do have a collective PowerPoint, and I will guide everybody through the presentation, but we're meeting today for this Board of Health special meeting to give you the perspective of the COVID-19 update, information around several different items, and then allow for our health partners to also add information that is valuable to this conversation. So tonight we'll talk about where we are in Guilford County as far as COVID-19 metrics. We'll move to talk about something that's called a pandemic vulnerability index, and I'll explain that just a little bit later. We have a comparison with peer counties in some of these metrics. Information around the mask effectiveness studies, around the effectiveness of masks in general. And then we also have studies included into the presentation that are really focusing on mask mandates effectiveness. We'll move into comments from our healthcare community, and we will be more than happy to also take questions at the end of the presentation. So in the first section of this presentation, you can see here the graph around the pandemic cases from the very beginning and the different surges that we've had. The beginning of February of last year, the Delta variant surge, somewhere in this fall, August, starting in August throughout September, and then the latest, most recent increase in surge in cases, which is exponentially higher than all of the other surges that we've had, starting in the week before the Christmas holidays and moving into the new year, with days in which we've reported up to 1,400 new cases in a day. We have a closer look at the more granular distribution of these cases over the past 30 days. with mid-December staying within the 200 new cases a day, which was pretty much the standard over the last few months, couple of months at least. And then we're seeing the last week in December cases moving up to the thousands. And then in the first week of January, like I've said, over 1,000 cases with days that have reached 1,400 new cases a day. Just as a note, the last 4 to 5 days on this graph are incomplete bars. We're still receiving information on these new cases as we speak, since it's a little bit too early to say that those last days are full, complete data, since we're collecting this in real time. When we look at our positivity rate, this information really shows the number of tests that are being completed throughout the county, how the positivity rate has been fluctuating throughout this time. And you can really see that in the last 2 weeks, our positivity rate has reached the highest number that we've ever recorded throughout this pandemic. This graph is just really showing where we are as a whole. To give you a bigger perspective, the 26.8% positivity rate was the percentage that was reported yesterday. We did not have an opportunity to update this graph before this meeting, but for today's most recent positivity rate, we are at 27.4%, 14 days rolling average, with the daily positivity rate at 29.2. I also mentioned that I will talk a little bit about an indication of where we are in the pandemic, described by the NIH as the Pandemic Vulnerability Index. This particular calculation is based on 4 categories that you can see on the right-hand side of the slide, which includes infection rate, population concentration, intervention, and health environment. And these 4 larger categories are encompassing 12 overall variables that are giving each and every single county in the United States this vulnerability index, or a PVI. And the way that they're calculated, each one of these variables has a different weight in the way that is they're calculated. We're looking at transmissible cases, the disease spread, the mobility of the population in that particular jurisdiction, the residential density, social distancing strategies, the testing that is being performed, and then also health and environment variables such as population demographics, air pollution, age distribution, comorbidities that exist in those communities, health disparities, and also hospital beds. So after all of these 12 variables are being analyzed, a score is being given. For Guilford County yesterday, the score was 0.58%. And the higher the score, the maximum is 1. So the closer it is to 1, the higher the vulnerability of that county. The lower it is, the better that county is it's performing when it comes to the pandemic. For Guilford County, you can see that some of the ones that are mostly impactful in the way that the index is calculated are the transmissible cases, so the number of new cases that are being identified, which is the red slice in that graphic. But then we're also highly weighted by the population mobility, residential density, and the social distancing categories that drive this index. With the help of our team in the health department, we were able to compare over time how this pandemic vulnerability index has presented not only for Guilford County, but also for 3 other counties, comparison with Mecklenburg in the purple line, Orange County in the red line, and Wake County in the green line. Overall, you can see that throughout the entire time that we've looked at this, Guilford County has had a higher vulnerability index than all of the other counties. We have communities with more comorbidities. We have more density in certain areas. We have areas that are being that are driving this vulnerability index higher than everybody else. The two bars in the middle of the graph show the time that we have instituted a mask mandate in the past, in August of 2021, and then the second bar shows the time when the mask mandate was lifted. And you can see that when the mask mandated was instituted, we were in an upward slope with that vulnerability index going up. After about 2 weeks, we've consistently plateaued, and all of those variables have balanced them out, and then the graph is trending downwards with 2 more weeks of downward trend after the mask mandate was lifted, which normally shows some residual effects of that mask mandate, with then the cases going up in a very sharp or the index, actually, these are not cases, I apologize, the index going up at a sharp rate. You can see that overall, we are comparing with the other counties in the sense that everybody is going up at that time when the Omicron came around. But what I'm trying to show with this particular graph is the fact that overall Guilford County's vulnerability index is higher than in these 3 counties that we compared it with. So any type of mitigation strategies that we need to put in place are very significant in the way that we can keep the community safe, and the way that all of these variables are coming together to really show that Guilford County it's more vulnerable when it comes to the pandemic. This table here really shows just a little bit of a different perspective in the way that we're comparing with other counties. This particular one shows peer jurisdictions in North Carolina that have a mask mandate in place. And we're looking at Orange County, Mecklenburg County, and the city of Charlotte. They have 2 standing mask mandates. Buncombe County, Wake County, and the city of Raleigh, which also has, they also have 2 different ones. Forsyth County and the city of Winston-Salem. And the reason why that is has a little highlight there is because it's the city of Winston-Salem that has a mask mandate, not Forsyth County as a whole, but most of these parameters are driven by counties. And then Durham County, and at the bottom, Guilford. And you can very clearly see that as of yesterday, when we look at the positivity rate for all of these counties, Guilford County has the highest positivity rate compared to all of them, just a little bit higher than Forsyth County at 26%. So Orange County is way below us at 15%. Buncombe County way below us at 19%. Durham County 21%, and so on and so forth. And then we also compared the vulnerability index for all of these counties as well. And you can see that with the exception of Durham County and then Forsyth County as well, all of the other counties have a lower vulnerability index as well. One of the explanations for Durham County is that their population density is different, since they're a smaller county. It is an urban county, and they do not have as many rural and suburban areas the way that Guilford County has. So they get a higher score based on that. But all of the all across, they're performing better when it comes to that vulnerability index than where Guilford County is at this time. This particular graph also tries to paint the picture a little bit in comparison with Orange County and Wake County in relationship to the positivity trend line. So we're moving into positivity, and the yellow line at the beginning of the graph shows the time when vaccines became available and the way that the positivity trends were going downwards towards the beginning of the summer. And then we're moving into the surge that happened starting the middle of the summer with the red line, the red bar representing the time that Orange County instituted their mask mandate, the blue bar showing the time when Guilford County instituted the mask mandate, and the green line showing the time when Wake County instituted their mask mandate. So just a little bit of a time frame of how the mask mandates have been instituted in these 3 counties. And you can show how overall the Wake County and Orange County started trending lower than us, but we were all in a downward trend to the point where we were all very close together at the time that Guilford County lifted the mask mandate, which is where that blue line shows. And then we can see how after the removal of the mask mandate in Guilford County, Orange County and Wake County continue to stay lower when it comes to positivity rate. Guilford County started detaching ourselves from this graph to the point in mid-December when all of us confluence, and they show a very close limit between each other. And one would say that we are in the same situation that all of these other 2 counties are, and that since we're very similar, but Guilford County still trends more in this particular graph, and we just need to consider the fact that with more mitigation strategies in place, we can help to further decline this positivity rate and make them be more comparable and start seeing that decline and that decrease in positivity rate faster and quicker. The next part of the presentation, I'm going to focus a little bit on mask effectiveness in the studies that we went over that show the effectiveness of masks in general. This particular study is actually a meta-analysis, which brings together 21 studies that have been included in this analysis, and it suggests that mask use provided a significant protective effect. It has statistically important significance, and the use of masks by both healthcare workers and non-healthcare workers can reduce the risk of respiratory virus infection, sometimes even by 80%. So this is just an overall analysis of 21 different studies. We also included this study around the evidence review of face masks against COVID-19 done at the University of Austin, Texas. And I've also highlighted here the fact that the evidence indicates that mask wearing reduced transmissibility per contact by reducing transmission of infected respiratory particles in both laboratory and clinical contexts. And then the last slide around mask effectiveness in general includes a peer review summary of a variety of different studies done by our partners at North Carolina DHHS. The link is included here, and it takes you to a document that includes 22 peer review scientific journals or scientific research studies, and that nearly all of these studies conclude that outside of the healthcare setting, wearing a face mask reduced one's risk of being exposed to SARS-CoV-2 virus and transmitting the virus to others if infected. So there's a lot of information that is on this slide that can that lists all of these 22 studies, and each one of them, what is the summary of the study, but I've just included the overall summary of this scientific brief that DHHS has put together. Moving into the next part of the presentation around mask requirements or mask mandates and their effectiveness, we have several different studies that are showing the way that masks are working to decrease not only infection and rates, but hospitalizations and significant and serious infection. So we'll start with this study that was published in the Mortality and Morbidity Weekly Report by the CDC that overall summarized the fact that a reported decline in weekly COVID-19 associated hospitalizations growth rates by up to 5.6 percentage points for adults aged 18 to 64 years after the mandate implementation was statistically relevant, and those masking mandates helped decrease hospitalizations rates in the 10 states where data was collected from. Another study shows the mask mandates and COVID-19 related symptoms in the United States. And this study found that public health mask mandates lowered the incidence of developing all COVID-19 symptoms by 0.29 percentage points, which estimates that implies the average decrease of risk by 290%. And that surgical masks are found to decrease the release of influenza virus and coronavirus particles in respiratory droplets. And homemade cloth masks, despite being less competent than surgical masks, are still much more capable of blocking the dispersal of microorganism droplet than without a mask scenario. We have another study published in September of 2021. The analysis in this particular study shows that mask mandate is consistently associated with lower infection rates in the short term, and early adoption of a mask mandate boosts the long-term efficacy as well. We have another study that shows that in US counties, in states where mask mandates were adopted, there were 43 less likely to have rapid increases in COVID-19 rates. And we've included the link to all of these studies. This was published in May of 2021. This is a science brief from the CDC's website that contains over 50 different studies that show universal masking analysis and demonstrated the way that universal masking can lower infection rates significantly. And this particular slide just includes 7 additional studies that have been peer reviewed and listed in a variety of different prestigious publications that talk about mask mandates and requirements in a variety of different settings, from county, locals to state. And the benefits of having a mask mandate in the sense of decreasing transmission, decreasing different metrics associated with COVID-19. And this concludes my part of the presentation. I am going to now ask Dr. Mary Jo Cagle from Cone Health, CEO of Cone Health, to give a few comments, and then we'll move into Dr. Snyder's presentation, and I will let both of them introduce themselves at this time.
Thank you, Dr. Van. I thank you all for being here this evening to talk about this important matter. And I don't want to take up much of your time, but I do want to share with you from my heart how important this is to us. Really, I have always felt like from the day I took the Hippocratic Oath to become a physician till today, that my most important responsibility is to protect the lives of others, to prevent unnecessary death, and when I can, to keep people out of the hospital. And certainly to keep people who are in the hospital safe from harm. And this is what this conversation tonight is about. You've all heard me either in this meeting or I hope on in the press conference that I had with my fellow CEOs from Navant and Wake Forest Baptist, talk about the situation we are in with our health systems. And it is real. We are stretched thin. And really, we're coming to you all for help with this situation. This is a community situation that's going to take community effort to keep those that we all serve safe. As of this morning at 7:30, we had 303 COVID positive patients throughout our health system. That is a new high for us. And it is becoming more difficult every day to find well and healthy staff to care for all of those. I'm sure Dr. Snyder is going to share with you all the staffing challenges we have because of the positivity rates among our staff. But we know the things that work. Dr. Van has shown what we know about masking. We know that helps. We know that vaccinations and boosters help. We know that people who have had full vaccination and a booster decrease their likelihood of being hospitalized by 17 times greater than those who don't have that protection. And they protect themselves from death by 20 times greater than those who don't have that protection. So yes, we've got to get the word out that people need full vaccination and a booster. And we welcome the opportunity to partner with Dr. Van and the Public Health Department to increase those numbers. So those 3 W's work, and we want to help that to be more widely available in our department. Since I last spoke with you, we were able to partner with Dr. Van and with the state and get a mass testing site up and running. And we're so pleased that that was able to happen so very quickly. So when we work together, we can get things done very quickly and very well. And that's why we're here with you today. I do want to share just a brief paragraph of an email that I received, honestly, at 2 minutes before this meeting started from one of our nurses that says, at 7:30 a.m. every morning at our capacity call, leadership continues to share and collaborate and implement the numerous strategies occurring throughout Cone Health to provide exceptional care for our patients. Yet, hospital census keeps climbing. We have reached the point where healthcare facilities needs the help of our community too. I have hoped that with your outreach, the more community members will begin to understand the positive or negative impact that they can have based on what they choose to do. So folks, our nursing staff knows that the community can have an impact on how successful they are at caring for our patients. And that's why we come to you tonight. Dr. Snyder, I'll turn it over to you.
Thank you, Dr. Cagle. And commissioners, thank you so much for giving us this opportunity to discuss the state of COVID in our community. And next slide, please. So as you can see here, over the last 2.5 weeks, we've had an exceptional exponential rate of explosion of cases. Within Cone Health, we have captured several thousands of cases. And the most important aspects of this too is what's happening in our emergency rooms, in our urgent care centers. As many people know, this is the forefront of where a lot of uninsured patients go, and also everybody else. And as you can see in this graph, we've had 100% increase in 2 weeks. This is the highest we've ever seen during this pandemic, and actually overall. And on top of this is that we are seeing more influenza-like illness on top of COVID illness, that we are still exceptionally worried that not only is there not enough access to care for those who have COVID and non-COVID reasons, but we really are trying to figure out the best access points for our patients and their needs. Next slide. So kind of some key points. We know that we've had very high community transmission. There's probably some significant undercount because there's still some difficulty getting access to tests, and test time turnaround is even anywhere in the 5 to 7 day range for some of the testing sites. We have an exceptionally high volume of ED traffic. And as Dr. Cagle has mentioned, we have had an all-time high of about 306 patients this morning. And this exceeds the high census since even a year ago when we had another campus taking care of COVID patients. The reasons why it's also very different is that Omicron It's exceedingly infectious, has a very short incubation period. So we're going to have this explosion of cases that we're seeing. The monoclonal antibodies that we used even 2-3 weeks ago do not work for Omicron, and nationwide have not been used anymore. And so the options that we have are very limited. The federal disbursement of the new monoclonal antibody and some of the antivirals are very small in comparison to what we had. So for us to prevent hospitalizations is also hampered this way. When we talk about how many cases of COVID patients we have in our community, I would be amiss if I didn't mention that it's also impacting our healthcare teams. In the past 2.5 weeks, we have had a total of 834 teammates with COVID. On this given day, we have 400 people who are out, 100 of which are nurses. Every single person on that list of 400 are out for COVID. And that is startling. That to me represents the challenges of us trying to give care, the excellent care that we want to give to our patients. In total, in this last 2 weeks, 6% of our total healthcare employees have been infected. And we don't anticipate that to change given how infectious this is in the community. We have to look at the public health interventions that do work. We know that indoor masking is highly effective. And again, vaccinations in the meantime, and then really encourage people not to be going into crowded indoor settings, and especially if they're not wearing a mask. Next slide. So our projections, at least internally, is that we still anticipate to see anywhere from 260 to 320 hospitalized patients in this coming week. We have a sense that it's slowing down a little bit, but still exceedingly high. But there's still a lot of unknowns. You know, we know that there's undercounting of cases due to testing availability. There's still exceedingly amounts of community transmission in schools and workplaces. And the utilization of these projections are really based on what we know so far. This doesn't account for any new interventions that we hope that are going to be placed tonight. Next slide. So the impact that a lot of people have felt already over those last 2 weeks is not only are we limited in our healthcare teams, obviously I think everybody's been impacted by their kids' schools, you know, be it their teachers, their principals are out, their school bus drivers are out, daycares are also affected, businesses and emergency services. This disruption across a lot of service lines, a lot of businesses, ultimately impacts all families, right? That disruption to schools as well as in-person classes. These long ED waits are incredibly challenging for all health systems that provide care in the Guilford County. We really want to decrease those wait times so that we can ensure that we're providing the appropriate care for those who are really emergent and urgent, who need to be admitted quickly. In order to try to decrease some of those needs in the hospital, there have been some delays on elective procedures at health systems, but this is primarily obviously also due to limited staffing. Next slide. So a lot of people, there's probably been a lot of discussion over this last week about different types of masks. We know that different masks have different filtration effectiveness, but the key common thing to know is that they all reduce that transmission risk to some extent. So again, be it if it's a cloth mask, if it's a surgical mask, if it's a KN95 or N95 mask, they all work. Obviously, one's better than the other. We are still focusing on everybody getting surgical masks and N95s, but the key thing that we have to note is that the biggest risks are indoors, especially now as we are in winter. And the key thing is really providing that opportunity to provide personal protection for the individual as well as source control so it protects all your coworkers. Next. So as Dr. Van had mentioned, there has been numerous studies that support risk reduction from masking. Anywhere from 30 to 50% of risk reduction occurs. Next slide. And often enough, a lot of people want to know, how did that help us in Guilford County during the Delta wave? Here is a comparison of counties who did not have a mask mandate during the Delta wave in comparison to Guilford County. Guilford County is the black dotted line at the bottom in comparison to the gray lines of the other counties. And as you can see, there is a noticeable difference. So this is actually proof that in our community, it does work. Even if it may not be 100%, the fact that the mandate was in place, that we had adherence to it, that was what we needed. We needed we needed to have everybody participate so that there was less transmission in our community. Sorry, one more slide. And here again, this is comparing that when you have counties with mask mandates, they have likely lower cases and in turn lower positivity rate. And Guilford County here is in the gray line. Next slide. So in conclusion, we know that masking is a known and proven approach for source control as well as personal protection. If we have more people wearing those masks, the probability of infection of spreading will decrease. We have ample information and results from our previous intervention, knowing that community-wide masking does show a reduced case rate. And right now in the Omicron surge, this is taxing us beyond an incredible part of that. I don't think many of us anticipated how quickly this would come in our community. It's not only stressed healthcare institutions, public health, medical and emergency services, far more than any previous wave. And I think everybody's very dedicated to continuing to providing great care in our community, keeping everybody whole, keeping their families working, keeping their kids in school. But what we need right now is still the community. We'd like to still have everybody mask indoors, and have this mask mandate can definitely alleviate some of the deleterious effects that's happened already in the first 2 weeks of the surge. Thank you for the time.
Thank you, Dr. Snyder. So we're going to go over to Mr. Jim Albright, our Director from Emergency Services. I do not believe that we have been joined by the other two healthcare system representatives. So Mr. Albright.
Yes, so there were several mentions tonight about the impact recently on emergency services, and I want to give you that perspective from a department. Since December 25th, so since Christmas Day, emergency services has had to exclude 57 of our team members due to exposure and or signs and symptoms consistent with COVID. Of those 57, 41 have been positive and 15 remain out of work. What that means to us is that we have 275 full-time authorized strength within the department. So we've been functioning at about 20% down of our normal staff availability. If I carry that over to our Guilford County Sheriff's Office, they've had 67 employees excluded from work since Christmas Day, 45 of which are positive, and we still have a number of those tests forthcoming. This is a very different place than where we've been. And in fact, I came to y'all in September to talk about the fact that we were seeing explosive call volume increases, et cetera. We returned to normal soon thereafter, but very soon thereafter, or in the last couple of weeks, we've seen that increase come back. We average about 220 calls a day for service. Yesterday was the busiest day in the history of the ambulance service, and we served 320 of our citizens. So we don't have the resources to match the demand that currently is occurring in our community. We're also in a very different place than where we were in March of 2020 when this started. In disaster preparedness, we really look at this as the stuff, the staff, the space, and the standards to handle an emergency. We were very limited with PPE and other options early on in this particular event, but we had a robust staff. We are seeing issues with staff fatigue and attrition like we've never seen. And those increasing workload demands are contributing to that. So we're at a point now, we're just looking for help from any options that exist. It certainly is a strong belief and supported by the North Carolina Healthcare Association that vaccine and boosters, masking, distancing, and et cetera are all control measures when we're dealing with an issue such as this. Dr. Van, I'll turn it back over to you.
Thank you so much, Mr. Albright. This concludes our presentation and the slides. So I am happy to turn it over to the chairman to continue the conversation.
Thank you, Dr. Van. Thank you, Dr. Cagle, Dr. Snyder, and thank you also, Jim. I guess what we need to do is now I recognize Commissioner Mary Beth Murphy to entertain a motion for us to have discussion.
Thank you, Mr. Chairman. At this time, I move approval of the proposed Board of Health rule as filed with the clerk with the following amendment to Section 6. Section 6 to now read as follows. This Board of Health rule becomes effective upon adoption and will remain in effect until the earlier of 1, expiration or termination of the proclamation of a local emergency, 2, February 27th, 2022 at 5 p.m., or 3, modification or revocation by the Guilford County Board of Health. There are several factors influencing the decision to implement a mask mandate. The Board of Health intends to continue to review all of these factors, including the advice of our local health professionals, number of hospitalizations, ICU and ventilator utilization, emergency department wait times, ambulance unloading times at area hospitals, ambulance call response times, vaccination rate, and positivity rate. Additionally, the Board of Health intends to have a formal review of these data points on February the 3rd, and again during each scheduled Board of Commissioner meeting until a comprehensive review of these data suggests that we should lift the mask mandate.
Do I hear a second? Please unmute. Please unmute and have a second.
Second, Mr. Chairman.
Thank you, Ms. Cash. And now we're on the discussion on the proposed rule that has been presented by Commissioner Murphy. Any questions from any of our health board members at this time to any of our panelists or our staff? Any questions? Please unmute, identify yourself, and please ask your question.
Mr. Chairman, if I may at this time, I just want to start by first saying thank you to Dr. Van for a very comprehensive presentation. I thought you did a very good job outlining exactly why it is important that we institute this mask mandate. It's clear that the impacts of COVID in our community, which is exactly the community we're making a decision on behalf of, are significant. And in our role as a Board of Health, it's important that we act to do whatever is possible to ensure safety within our community. I want to say that I think it is critical that we are removing previous metrics that we used in order to determine whether or not we would lift the mask mandate in order to provide flexibility for this board to determine the necessity of an ongoing mandate. I am also glad to see and hope that the public recognizes it is our intention to have a regular review of this data as well. As early as February the 3rd, we will be noticing a meeting of this body as the Board of Health to review the data and determine on an ongoing basis the extent to which this mandate is necessary. So no further comments at this time, Mr. Chairman. Thank you again, Dr. Van and all of our special guests for providing such a critical insight to help us be guided in this decision-making process.
Thank you, Ms. Murphy. I appreciate those remarks. Any other questions from any of the commissioners or health board members?
Mr. Chair, I'd like to just make a comment. Commissioner Foster, Wake Forest, Atrium Wake Forest representatives are not on this call this evening for whatever reason, but I do want to say that I personally spoke with them to get a better understanding of the impact on this virus, particularly in the High Point area where the majority of my constituents are. I felt that it was very important for me to know, in addition to cone what the impact was in my community. I, like other commissioners, have received many emails, both for the mandate as well as against the mandate. But as the Board of Health, I do agree that it is important that we do what we can to limit the spread of the virus, to try to limit the number of people coming into the hospital, and weigh in the advice of the healthcare professionals, the number of cases in our county, the positivity rate, and citizen input. I am led to support a mask mandate. So thank you.
Thank you, Commissioner Foster. Health
Mr.
Board Member Foster.
Mr. Chairman.
Yes, Ms. Cashin.
Oh, okay. Wasn't sure you looked up and saw me there. I have a question for Dr. Snyder. I'm not sure I made this note just right, and it's not quite clear to me now that I look back over all my writings, but Dr. Snyder, you referred to a 100% increase in the last 2 weeks. I think you were referring to 100% increase in number of occupied beds, but was that the reference, or was it in positivity rate, or could you explain that a little better to me?
Sure. That is the volume of increase in our emergency rooms in 2 weeks.
Did you determine how much of that 100% increase was due to issues other than those related to COVID or Omicron?
We did not differentiate that, and we can. The key part is that we were concerned about the wait time that individuals were having to not only be housed in the emergency room, to be admitted, as well as the time to be seen, how long people were waiting in our emergency rooms to be seen. So we suspect that other markers that we look at every day is how many patients who met the qualifications to be admitted who are still residing in the emergency rooms, and that, in a way takes up, kind of slows down that process of somebody to be seen. In terms of our COVID numbers, like how many patients who have been admitted, that has increased easily also by 100%. We, coming into Christmas, we were probably in the 150s. And then over that Christmas to New Year's time period, we were getting closer to we were in the 200 range. And then the quick escalation to 300 happened in the last 5 days.
Oh, okay. Thank you. Mr. Chairman, I don't have another question, but I would like to make a comment, if I may.
Go ahead.
Yeah. As everyone else has, I'm sure I have received many, many, many emails and telephone calls over the last several days. And I just want the public to know that, I appreciate and respect everyone's opinions and thoughts on this issue. Could not return all the calls, could have not returned all the emails. I think I cleared out 50 some calls off my phone, and obviously I couldn't return all of those, but I do appreciate the public weighing in on this. And we had all hoped that we would not be at this point again, evaluating what we could do to help alleviate this serious situation. We had hoped that the numbers would continue to go down or level out and that we would be okay, but here we are. And we got a number of citizens and medical professionals who have weighed in on this. I have had a conversation with, a number of conversations, but pointing toward 4 different businesses, locally owned businesses. One was a restaurant, one was retail, and 2 were service operations. All 4 of those told me that they really wanted us to put this mandate back in, even though they didn't like it personally, and I don't like it personally. They wanted us to put it in because it helped protect their employees. This was a way of putting the signs up and saying to the public as they come in, this is what we want you to do. We prefer that you do. And one gentleman said, and plus the fact, we get to blame the county commissioners for this, but at the same time, we protect our people. So I think that's probably the general response, even though that would be the general response, even though maybe not everybody has expressed it openly. So we can't please everyone. I learned that a long time ago. So for me, I'm just going to have to respect the advice of our medical advisors, and I will be supporting the motion. Thank you.
Thank you, Ms. Cash. Further discussion on the motion?
Mr. Chairman, I have my hand up.
Oh, Mr. Conrad, I'm sorry. I didn't
Thank
see
you,
your hand. Thank you.
No problem. Thank you, Mr. Chairman. I appreciate it. I just want to make a comment. And it's water under the bridge, I assume, at this point. But at our last meeting and our discussion about this, I brought up a National Institute of Health study, and I made sure that I sent that to the clerk immediately, actually during the meeting, to distribute to both Dr. Van and the board. And when I hadn't seen the email come out, I followed up again with our clerk to make sure that each individual had this information. And I think getting that information is very important. And I'm a little frustrated we didn't see any of this information, Dr. Van, that you presented. One was a National Institute of Health study. What I sent you was also a National Institute of Health study. I think if that shows anything, it may show that there is a little bit more disagreement within the health community than what may have been presented here. It's interesting to me that when you sent, and I wanted to make sure that you saw it, obviously, and you saw it, and I did not ask you a question about it without looking at the study. I was very clear about that in our last meeting, that I wanted to make sure you had time to read that and then give your comments. But one of the things you said is it's an old study looking at data from 18 months ago in the relatively early stages of the pandemic, June to early September. One of the studies you used was March to October of the same year. And so I think getting that information ahead of hand would have certainly been appreciated by myself at least, and maybe some of the other commissioners. I'll stand with my objections as they have been through this whole process. Questions about enforcement, questions about shouldn't we be offering more of a carrot approach, which is my opinion to the community. I do think there's some things we could do certainly among our congregate living and some of our most absolutely critical citizens that are out there in the community. Commissioner Perdue had a fantastic point at our last meeting about educating people to their health care options at the time so we don't overburden our healthcare systems. And I think some of those things we could be doing without going down this approach. So just that's my same objections as they've always been. But most importantly, when we have something of this magnitude and we have something presented, I certainly would appreciate information beforehand as opposed to just a screenshot of a summary. Thank you, Mr. Chairman.
Thank you, Mr. Conrad. I think for the record also, commissioners did receive your report. It went out the other day. I've received it. I don't know if the other commissioners received it or not, but I think they did. So we had the opportunity to take a look at it and take all of that in consideration also, just for the record. Commissioner Cook.
Thank you. Thanks, Mr. Chairman. I don't have any questions. Like many of the other commissioners, I have spent the last week buried in my own research and in conversation with many of the health professionals on this call. I appreciate all of the hard work that you all have done to present as much information as you can as we approach this decision. I want to echo some of the comments we've already heard from other commissioners. I recognize that everyone in our community and across the world is very tired. We are all so tired. And I recognize that the proposed mandate presents some challenges for businesses. But I also have to recognize that access to our healthcare and the workforce that supports our community are in jeopardy because of where we are in this pandemic yet again. And I cannot ignore a plea such as what we've just heard from our medical providers, from those who we entrust our care to. So I have to consider that with my vote, even though it's not where I hoped we would be. I don't think it's where any of us hoped we would be. I also think it's important, as they mentioned with respect to our community and our workforce, that we have this opportunity, that we take this opportunity to support those we are asking to educate our children, to care for our children, those that we're asking to staff the places where we go and buy our food and necessities. If we have the option to do what we can to protect them in this moment of incredible spread, that we have to do that. But again, I want to say that I recognize it places a burden on some of our small businesses, especially. And I think it's of utmost importance that the duration of the mandate is only to the point where it's still necessary and no longer than that. So I'm very pleased that we were able to work into that language, that we will have periodic review and that we will take those reviews very seriously to make sure that we're only imposing this as long as it's absolutely necessary. Thank you.
Thank you, Commissioner Cook. Commissioner Upchurch.
I have a lot of questions and a lot of comments, but I'm going to keep most of them to myself since I've already made them. Ultimately, it's my responsibility to listen to my constituents and what they want. And it's been clear by my constituents that they don't want this mask mandate. So for that reason alone, I'm not going to be supporting this mandate. But I did have a lot of questions in regards to the effectiveness of mask mandates. And we talked about that before, Dr. Van. I didn't see that information presented today. We know that if you look at the NCDHHS website and you look at Mecklenburg, look at Wake, Durham, Forsyth, even though the mask mandate's only in Winston, places that have done mask mandates in North Carolina, they haven't been very effective. 50 to 100% higher cases than we currently have. And, earlier, Dr. Van, you talked about positivity rate and then this vulnerability index, which I haven't really heard much talk of until today. Well, you might have mentioned it once or twice before, but, it seems like the most important metrics that we're looking at are cases, hospitalizations, and deaths. And it was very strange that those things were not mentioned in that study. I do want to ask a question to Dr. Cagle. Or Dr. Snyder, either one of you can answer this. I heard earlier today, Dr. Uhl was on television. He works for, I believe, Wake Hospital. And he mentioned that he expects the peak of the Omicron to reach the peak next week. Can you confirm that according to what your data scientists are seeing? Do you think that we'll hit the peak next week?
There's a good chance that we are starting to peak, although I think it is too early to tell. It is based really on a couple indicators, obviously testing, how many cases we see, as well as I believe today the state of North Carolina posted a significant amount of cases. And then also we know that there's a delay into hospitalizations. So we are cautiously optimistic that the peak will come. But the good thing to note about this is that when you do an intervention in a process that has a short incubation period, that the impact of that intervention will be seen quickly. So as opposed to some of the information that Dr. Van had posted about doing a mask mandate originally last year, and we saw the cases starting to trend down a few weeks later, that won't be the case here. Because this is a short incubation period of 3 to 5 days, that if you were to do a mask mandate in place tomorrow, we can easily start seeing also a further decline of cases because of that intervention being in place.
Yeah, I'll just add, because I'm on statewide calls daily, we're at the highest rate of hospitalization statewide today and cases. So as I've talked to our data analyst who talks to all the local data analysts, everything is shaping up toward, we believe, a trend for the highest number of cases in the next, I would say, 3 to 5 days if our data holds. And Mr. Upchurch, I think you're a data scientist, I believe, and I think you know that we run multiple models every day, and then we try to see which one fits, and we adjust it every day. So if our peak of cases hits in the next 3 to 5 days, our peak of hospitalizations will hit about a week after that. So probably in for the next 2 to 3 weeks being our most intense weeks. That's what we expect. If that's addressing your question directly.
No, that does address my question. I just also wanted for you to confirm this, I guess, this data that I have, and you might not have it in front of you, but if you go on, again, the NCDHHS website, it talks about the severity of Omicron and where we kind of are with that. And according to the data that we have most recently from last week, we are at the lowest percentage of adults in ICU than we have been throughout this whole pandemic. And so we know that this variant so far with the data that we have is less severe, but also understand that because cases are increasing, hospitalizations are being overwhelmed. But just to recognize that the severity is less and that data is available on the NCDHHS website. So have you seen a reduction of severity and things like that in your hospital?
So we have fewer in the ICU, but we're being overwhelmed by the sheer volume of admissions. And I will say we've had 41 deaths since Christmas. So I guess for us, 41 deaths is a lot of deaths from one disease entity. So we can talk about that it's less severe, but to have 41 of our citizens die since Christmas from a disease, that doesn't seem very mild to me. You know, at my heart, I'm a clinician, and I don't like losing people from a disease, Mr. Upchurch. 41 of your citizens, of our neighbors have died since Christmas from this disease. One of them was a 43-year-old father with no previous known illnesses who came in with symptoms of a heart attack. And we took him to the cath lab, and we found out, because we couldn't find any blockages, we just found blood clots. And while he was on the table, we were trying to save him. We found out he was COVID positive with Omicron. And one of the things Omicron does is cause blood clots everywhere. And we couldn't save him. And our doctors had to go tell that mom. And there were little kids involved in that family. This is a terrible disease. So I understand that most people who get this are able to stay home. And most people don't have to go to ICU. But when it's bad, it's really bad. And my staff is traumatized from stories like this. And I know you guys, your inboxes are full of letters of people lobbying you, but you're representing your constituency. I'm representing mine. And mine are my staff that are traumatized going into year 3 of these terrible cases, and we're seeing it again. And, you know, I'm not trying to argue with y'all or beat up on y'all. Are in a hard spot, but this stuff is for real, and it's bad, and it's killing young people, and it seems so random to us. We can't predict for you guys how good or how bad it's going to be on any given day, and it's demoralizing our nurses and our doctors, and we are just asking for your help. That's all.
There's definitely no denying that. To follow up on a second question, you've mentioned that there's a severe shortage right now in terms of nurses and hospital staff, correct? Because of the amount of the amount of workers who have caught this virus in the last, couple weeks, correct?
Well, there's two pieces going on. So yes, that's it. Secondly is burnout. We've had nursing staff just step away because we're starting year 3 of this global pandemic. So you add that, and then you add now that we've got these infections going on. So that has compounded the problem.
Has there been any, and again, I'm not trying to, you're responsible for your staff, but I have a question. Has there, because we know how transmittable this virus is, has there been any consideration to change the policy that you have around, vaccinated hospital staff? I know that depending on which hospitals you're in, they fired a significant amount of workers, depending on which hospital system. And so
we didn't have a large number of people be fired. So,
okay.
So no, we haven't changed our policy, and we haven't had a need to.
Appreciate it. Okay. And Dr. Van, I guess this is my last question for you. We know that the last time we had a mask mandate, it was not strictly enforced. The public kind of, thinks this board is a joke because we did not enforce it last time. And I think I brought those concerns up the last time we were in the situation. Now we're in the situation again. So my last question is, how many staff members do we have that are going to be going out and doing the check to see if people are following these mandates? Because this is going to pass. We know this. So my question is, do we have the ability to enforce this, knowing that we don't have nurses, we don't have bus drivers, we don't have teachers, and our county staff have also been impacted, as Mr. Albright has said. So do we have the staff, to enforce this? Because to me, that seems highly unlikely, but maybe you have a different answer, or you can explain how many staff we do have that will be going out and making sure that this mandate is followed.
Yeah, sure. So we have two pieces to the enforcement part. We have our environmental health inspectors who are working in those areas that they normally inspect, and they're going to be able to do the enforcement in those particular environments. And then we've been able to bring back all of our team members that have been working under the mask mandate last time. So we would be able to quickly be online with enforcement if the board voted for this tonight. We don't have to train anybody. We don't have to hire anybody. They're already ready to go out tomorrow, provide education, provide the kits, the marketing kits, and provide that support to our businesses and organizations. I think that we've been able to do a really good job with responding to all of the complaints and the violations that we became aware of during that time. We've had help with our GIS department to really divide the workload for those enforcement officers, and to even do proactive reach out to businesses, not just complaint-based type of response. We know that with anything that has to be enforced, and this includes the mask mandate, but we know, anything from a seatbelt to a stop sign, it can be enforced, or sometimes it's not. It depends on what circumstance you're in. So our team is doing the best to be able to respond to all of the violations that we become aware of, and do proactive reach out to our communities, community organizations as well.
Okay, thank you, Dr. Van. Each meeting I'm going to be asking for I guess a review of how this is going, and to see if there's been any warnings or fines given out, because I do think that the enforceability of this is going to really determine how the public perceives this mandate. So I have a lot more questions and comments, Mr. Chairman, but I'll save them for another time because I've already covered them in prior meetings. Thank you.
Thank you, Mr. Upchurch. Let me first of all take issue with the fact that Mr. Upchurch analysis of this board is a joke. This is not a joke.
I didn't say that, Mr. Chairman. I didn't say this board was a joke. I never said that.
I think you said exactly. I think you said exactly that, Mr. Upchurch. And
no, I did not. I said the public. That is the perception of the public. I did not say that.
Okay. To the public, then, this board is not a joke. Our enforcement policies have been in place when we had the last mandate. We did issue our warnings, citations. It is not our desire to issue citations. We want the public to cooperate on their own. And we want them to be educated based on what we are trying to put before them on behalf of all of the citizens here in Guilford County. Yes, we have those enforcement measures in hand, and they are part of the rule. And if we have some folks out there that are not abiding by that rule blatantly, not abiding by those rules, yes, they will be taken care of, and fines will be implemented. And but we don't want to put more burden on our businesses than we have to. But our first priority is to protect our citizens. And that's what we're going to be doing. And that's no joke, because this virus is no joke. Like Dr. Cagle said, this virus is killing people, 41 people since Christmas. That's no joke to those families that lost those members. So to characterize anyone to characterize this board as being a joke, I take offense to that. Okay, any other questions from any commissioners? Hearing none, I ask the clerk to call the roll.
Thank you, Mr. Chairman. Commissioner Coleman, how do you vote? Just a minute, Commissioner Coleman, let me get you to unmute, please. Commissioner Coleman, I'm going to come back to you. You're still muted. I'm going to move on to Commissioner Foster. How do you vote?
Yes.
Commissioner Murphy, how do you vote?
Yes.
Commissioner Cook?
Yes.
Commissioner Upchurch?
No.
Commissioner Conrad?
No.
Commissioner Purdue?
No.
Commissioner Cashin?
Yes.
Commissioner Coleman?
Yes. Can you hear me?
Yes, ma'am. Thank you. I hear you loud and clear.
If I may, please let me just make a very brief statement. And it's personal. On last Saturday, I had a friend to visit my home from Raleigh, and he spent the day, and of course, on Sunday morning, he called me saying that he wasn't feeling well. Sunday afternoon, he called back and said he'd been to the hospital and he tested positive for COVID. At that point, he said to me, "You need to go and have the test also." I can tell you, this is no joke. When someone tells you that they've tested positive for COVID, and you are wondering if now you're testing positive, that is one of the scariest feelings that I've ever had. I'm afraid of it. I don't know how many of you have had the experience of having to go and get a test, but I can tell you that this week I've spoken with 3 friends that have had to go and get the test because they had been near someone at work and they thought that they may have contracted the disease. I can tell you that your constituents are my constituents. I don't care where they live. If one person in Greensboro, one person in America dies from this disease, it impacts all of us, because you cannot see a family member grieving because someone in the family has died and you think it's a joke. It is no joke, people. Just this week also, I said to my grandson, who is a young fellow, how would you feel? This was before I had the test. How would you feel? And of course, he would not test. And I said to him, how would you feel if I died and you have to walk around all of your life thinking that you were responsible for your grandmother's death? I'm sure that's a terrible feeling also. So not only am I voting yes, but I'm also saying to people that have not been tested, people that have not had the vaccinations. Please, for your sake and for our sake, go and have it immediately. Thank you, Mr. Austin.
Thank you, Ms. Coleman. Very well said. Thank you for those comments.
And lastly, Mr. Chairman, how do you vote?
Yes.
Mr. Chairman, that motion carries on a 6-3 vote.
Thank you very much. And let me first of all, again, thank our medical professionals. This board is consistent. We know that we are politicians, and we are looking at our constituents as far as when we're making decisions, possibly how many votes we might lose if we make a tough decision. But you all have to look at how many lives can you save when you make the right decision. And I applaud you for that. This is not political. And we should put our people, just like you all are, we should put our people first and not politics. So I applaud you for that. This board has been consistent in listening to our medical professionals. We don't make a decision on our own. The last time we made a mask mandate, it was the call of the medical professionals. And that's when we put the mask mandate into place. And when we took the mask mandate off, it was the call and that the concurrence of the medical professionals. That's why we took it off. Now you all are coming back to us again, and we appreciate that because we don't know what you all see every day. We can only imagine being in a hospital, being in an emergency room where you have, like Dr. Cagle said a week ago, 80 patients in your emergency room, okay? And some of them are stacked in the hallways because you don't have beds to put them into and rooms to put them into. We can only imagine that. So our hats are off to you all, but what you all do for our community is very, very, very much appreciated. And the least we can do is give you a helping hand when you call. And that's what this vote is all about tonight. We're doing what we can with this mask mandate. Will it solve all of the problems? Will it stop the death? We don't know. But if it saves one life, it's worth it. And I will hope that the community will realize that and not fight against this, not try to agitate those the businesses that are trying to protect their employees and the public when they come and patronize them. At least we're not talking about a shutdown. Okay, as bad as this is, last year we had, the year before last, we had a shutdown. Okay, but we don't want to go back there. And we haven't talked about that. But the least we can do is ask people to wear a mask when you're out in public and practice the 3 W's. So again, Dr. Cagle, Dr. Snyder, and all of Dr. Van and Jim Albright, all of you all that are out there on the front line, thank you, thank you, thank you. Do I hear a motion to adjourn?
So moved.
Second.
Been moved and properly second that we adjourn. All those in favor, please remain silent. All those opposed, please unmute and say nay. Madam Clerk, we stand adjourned. Thank you very much.